I think maybe we can slowly start. While,
yeah, no problem. Let's get
trying a way to how to send it. So welcome to our next session about knowledge translation, methods for moving evidence into clinical practice that I'm co-chairing with Audrey-Jeanne Baudouin. We are very happy today to have Anita Menon join us. She's an assistant professor at the School of Physical and Occupational Therapy at McGill University. She completed a PhD degree in health administration with a specific focus on knowledge translation at the Department of Health Policy, Management and Evaluation of the University of Toronto. Dr. Menon has 10 years of teaching and research experience related to assessment and treatment of unilateral spatial neglect, stroke, rehabilitation, knowledge translation, and evidence-based practice. She is also the chair of the Edith Strauss Rehabilitation Research Project, which aims at enhancing clinical and academic partnership through KT initiatives, such as funding opportunities and educational events for capacity building in KT. I've heard previously the talk, at least some part of the talk of Anita about KT, and I hope you will enjoy it as much as I have every time. Thank you, Anita.
Thank you very much for the kind introduction. Welcome, everyone. And it's really my pleasure to offer this lecture on knowledge translation. It's an area that I'm very passionate about, very much interested in terms of my research work, in terms of my work as assistant professor at the School of P and OT, Physical and Occupational Therapy at McGill University. And it's really, we're trying to introduce the concepts of moving evidence into clinical practices and what are methods that we can really apply as clinicians, as students, and so really integrating that knowledge into our clinical practice. And so this is what I'd like to speak about today. So I'll just move forward. Oh, and I see there's a message in the chat. Okay. Oh, she's activated. Okay, give me a second. I'm just going to just proceed with sharing two documents that I'd like you to have with you handy during the talk. So let me just give me a second. I'll just stop sharing and try to share with you two documents. Give me a second here. Doesn't seem to be working. Okay, no worries. We'll just, I'll share these documents with you later on. It's not, no concern.
You can send them to Linda after, and then she can circulate to the participant.
Perfect.
Absolutely.
There, yeah. So there's just simply one is a sort of a background seminal paper in the area of knowledge translation written by Dr. Sharon Strauss, which is very interesting and a quick read. So I hopefully I'll circulate that to you, along with a blueprint for designing a knowledge translation implementation plan. If this is something that you think you might be interested in, depending on your research interest in area. So today I'll be basically doing an overview on knowledge translation, generally what is KT, how it's actually different from evidence-based practices, why it's important, really how you could situate the research work that you're involved in, and where it really applies, with it, whether it's knowledge creation or more in the application process. So really figuring out where your research work is, and then based on that, you will then figure out what would be the best ways to articulate your type of research. So would it be more of a KT dissemination plan or a KT implementation plan? And so I'll walk through those two concepts in greater detail in the next coming slides, more so in the implementation plan. And we'll discuss some potential projects at the end. Hopefully there'll be some time for discussion so we can discuss perhaps your project ideas. I could also present to you a project that was done at the MUHC, the Montreal Children's Hospital, and so I can introduce that project very quickly in terms of a implementation project that was done. But I really hope to hear from you and your research ideas and how you can best articulate why your research is important, but also why or how you could actually implement it or disseminate it using these methods. So moving along. So just wanting to hear, and feel free to either put in the chat or unmute what your definition of knowledge translation is. What is it? What are words that you've used? What do you think? What are terms that come to mind when you think of KT or knowledge translation? So feel free to share your ideas in the chat, or just simply unmute and share your thoughts. Okay, so I see your communication, definitely. So that's a really important part of knowledge translation, effective communication, but exchange, applying evidence into practice, dissemination of research findings, sharing results, publications, teaching knowledge users, moving research knowledge into clinical practice, improving, yeah. So really, yeah, exactly. So it's, you're really along the right lines. It's really bringing research to, yes, exactly as you said, to those key stakeholders. It's figuring out who needs the information, how can you package that information in a way that's meaningful for decision making. And yes, co-creation, very important. So it's really, the whole process is really an exchange among different stakeholders. And so it's really important to figure out who are those key stakeholders, who needs to be involved in that exchange process. And it's tailoring the research evidence in a way that's understandable, meaningful, and that could easily be applied in decision-making, either from the perspective of a physician or clinician, from the perspective of a patient, administrators, policymakers. So it's really thinking about who that audience is and how you can tailor that information accordingly. So knowledge translation is generally a method, but it's a methodology that's used to really work those details out in a more effective way. So those are really great terms. So just to basically define or formalize knowledge translation, it's really a dynamic, iterative process, and it really includes multiple steps. So you're looking at the process of which I talked about earlier, exchanging, making sure that you're exchanging information between the researchers that produce the research evidence with frontline clinicians who really have that hands-on experience, exchanging that information with patients, with administrators, decision makers. So there's a real exchange process that takes place between various stakeholders or individuals. There's a synthesis process that's really important in knowledge translation. You want to make sure that the information, the research evidence that's being implemented in practice is synthesized based on high quality research evidence that's also synthesized in a way that's easily understandable or easily applicable in clinical practices. So that synthesis process is really important in terms of just gathering the right evidence and summarizing it in a way that's relevant or meaningful. And then finally, application. So it really takes it to the next step forward. It's not just exchanging and synthesizing the evidence, but it's really figuring out how do you actually take that synthesized evidence and implement it, or make sure that the end users or the clinicians or the patients are really applying that knowledge in their day-to-day lives, in their day-to-day decision-making. So all of these words are very important in knowledge translation. And then of course, dissemination is another step where you may not be ready to actually apply the research evidence in clinical practice, perhaps because it's too early on, that there's further research that's needed before you really reach that step of applying it or implementing it in practice. So this is where you try to disseminate or share this information, getting individuals aware that this research evidence exists. And so the whole idea of this process of knowledge translation is really to improve patient outcomes. You're hoping to improve the services that you're offering to clients and really strengthening the healthcare system as a whole. So if you think of knowledge translation, it's really, it's a new area of research or a methodology that's being applied in research, but it's really addressing an old lingering problem. That's the fact that there is less or decreased use of evidence-based practices. There are huge gaps that exist in the practice setting, and it's really looking at addressing those gaps. So this whole thing happens in a very iterative way. And as you can imagine, there's multiple steps that need to take place, and that researchers and clinicians are really key. Their collaboration is really key to successful KT. So how is KT really different? And hopefully, as I'm walking you through these concepts, it becomes more clear in your mind, but how is KT really different from evidence-based practices? And so KT is really known as the method or methodology or process to really apply evidence in clinical practice. And so it really requires conscious participation from both researchers and the knowledge users, or the key stakeholders who are at the end. And so if you do a really good job at designing a rigorous KT intervention or a KT study, chances are you're going to be very successful at having clinicians adopt these best practices and use that information to inform their decision making. And so, really, it's what's really important with KT is that you want to make sure that you're using the most effective, up-to-date methodologies to really promote the use of best practices. So when you think of evidence-based practice, it's a decision-making process that's really informed by various sources of information. So of course, traditionally we look at the importance of research knowledge, scientific knowledge from different sources. So, in the process of KT, you are going to tap into the best research evidence that's available through RCTs, reviews, guidelines. But you also don't want to forget, the importance of clinical expertise, really tapping into that experiential knowledge, really reaching out to clinicians, physicians to understand, what that experiential knowledge is and how it can contribute to decision making. So really understanding that piece. And then finally, understanding patient knowledge, their objectives, their interests, their expectations, and really tying all these factors into to decision making. So, these three bubbles are really important in the process of knowledge translation. But what we do see overall is that there's a real lack of use of research evidence to guide our practices. And so hopefully with the use of effective KT methods or strategies, we can really be effective at moving research evidence in clinical practice. So again, to reiterate, that KT is really important to really address those existing practice gaps of the fact that patients aren't receiving optimal care. And so we see this in all areas of clinical practice. And so it really just becomes, knowledge translation can become a solution to addressing these very specific knowledge and practice gaps by providing a methodology to integrate evidence in practice. So what's really key here is, as frontline clinicians or researchers, is to really identify what are those clinical gaps, what are those emerging gaps. Prioritizing these gaps is a really important process as well, to then figure out, okay, which ones do I want to tackle first? Is it the sort of low-hanging fruit versus ones that are, maybe going to have a larger impact in terms of changing practices? So just to iterate why KT is important, what we see is that if we use effective KT strategies, we can really bring down that timeline that exists between when research evidence is available in the literature and when it actually reaches clinical practice, when it actually gets implemented. And so there's this huge gap, the 17-year gap that exists, and that we really want to break down by using effective KT strategies to make sure that we can move research evidence much more quickly in clinical practice. So there's often these death valleys that exist, or these gaps between research and practice. And so we see these valleys that exist between, more bench work type of research, clinical research as well. So there's sort of two valleys that exist between, biomedical research and clinical research, and then as well between clinical research and that exact decision making. So there are, two major translational gaps that we can see in this. And then here, this is where you want to look at, okay, where do I exist in this knowledge to practice continuum? Where is my research work in this continuum? And that will really help you decide what will be the best strategies to use. If you're really early on in the discovery phase or in the research phase, you might not be ready to implement the findings into clinical practice. And so that you might want to use more of a dissemination dissemination plan to really bring awareness of this research evidence at that point. But then later on, as you move forward in the knowledge creation and application continuum, you might be more ready to really apply the evidence that's being generated from these sort of phase 4 trials into the real world. And so you're more ready to really apply the research evidence into clinical practice and work on that application process. So, when we get towards the end of the presentation, I'd like to hear more about your research ideas or your research work that you're currently embarking in and where you are situated in this continuum. So based on where you are at in this continuum, you will really then be able to answer that question of, are you really ready for KT? And so you really want to be thoughtful in this process of when developing a KT intervention and really figuring out where you are. Are you in the process of creating knowledge? Or are you in the process of the fact that you're actually ready to apply this knowledge in clinical practice? And so based on that, you will figure out what type of KT is more suited for you. Is it the diffusion, dissemination, or implementation? So I'm going to walk through those different definitions. So diffusion is really where you're wanting to let it happen. This is where you're in the process of publishing research findings, conference presentations, sharing things in social media, sort of discoveries. And so you're just you're trying to just share the information and sort of let it happen, or diffuse the information in a much more passive way. Later on, depending on where you are in the continuum of your research work, you might be ready for dissemination, where you're trying to let it happen. And so here, you're really being very selective in your target audience. You're trying to figure out, who is the individuals that need this information at this point in time, and you're trying to tailor your message appropriately according to who that target audience is, whether it be patients, healthcare professionals, decision makers, policymakers. So you really need to figure out who your audience is. You have very clear objectives at that point in time, and then you want to tailor your message appropriately. So this is where you create more professional development workshops specific to that target audience. And then finally, once you've depending where you are in that research phase, when you're more towards the end, you have that goal of really wanting to actively implement that research evidence into clinical practice and actually yield changes in practice behaviors. So once you reach that point in time, this is where you're going to do a KT implementation study. Your KT methodology becomes very important, and so you become very deliberate in choosing the right methodology for your research work. And in the process of trying to implement research knowledge, you want to make sure that stakeholders and knowledge users are actually engaged in the entire process of trying to implement that research evidence. And so I'm going to speak more to that in the next coming slides. So in the process of, either deciding whether you're going to do a dissemination plan or a implementation plan, you will really need to be clear on who your knowledge user or who your target audience is. So this is actually defined as an individual who's going to be using the research work that you're trying to generate to make informed decisions. So, your knowledge user can be very much involved in your research work or your KT study. It really depends on the complexity of your project and the nature and the needs that you have of that knowledge user. So, examples of knowledge users could be healthcare professionals, policymakers, decision makers. It could be individuals in the public, the media. So you really need to figure out, who are those individuals that you want to target at that point in time, and how much do you want to get them involved in and engaged in your research process. So if you think of the outline for your KT dissemination plan, so if you're, way early on and you want to just share that information in a more passive way, here you want to create a KT dissemination plan. And so this is just an example of a document that was created for pediatric migraine and just summarizing sort of an infographic. And so even when creating these infographics, what's really important is to keep clear of what your goals are of your KT efforts in that infographic. What's your goal in terms of, the research evidence that you're trying to share? So are you trying to make individuals aware of a certain body of literature? Are you trying to share knowledge? Are you trying to inform future research or decision making? Are you trying to facilitate some kind of change in practice? So really figuring out, what your goal is, but that goal will really be determined based on the nature of your research findings and how far along you are in your research. So again, it could be very different in how much detail you would have in that infographic. The next thing would be is really figuring out who your knowledge users are. Is it the public, patients and their families? Who are those individuals? What their baseline knowledge about that information and how they're going to use this information. Strategies. So, what kind of strategies would you use to share, diffuse or disseminate this information? What formats would you use? Would it be online through a web-based format? Would it be through just infographics? So are you going to be using TV or media to share that information? So really figuring out what will be the most optimal, effective strategies, dissemination strategies to share that type of information. Then you would need to think about what kind of expertise do you need on your team when creating this dissemination plan. So important people to keep in mind whenever designing these types of infographics or designing a KT dissemination plan would be, having knowledge brokers, community members, KT specialists could be very useful, communication specialists, graphic designers. So these are just things to think about in terms of who you need to be having on your team. And then finally, resources, of course, finances, money, funding, and any human resources that you would need to support this plan. So this is just a quick overview of how you would design a KT dissemination plan. But the next coming slides will really focus on how to really design a KT implementation plan, which is a much more active dissemination plan. And this is when you have research evidence much more clearly defined, and you have a larger body of evidence to be able to implement in clinical practice. And so this is where this knowledge to action model is a research model. It's a knowledge translation process model that can be used to guide your process of basically translating research evidence into clinical practice. But what you want to make sure is that you're engaging the knowledge user in the process, and you're really tailoring the knowledge to meet that local context. So whether it be a clinical setting, whether it be the community, it really needs to be identified in that project. So the knowledge to action model is a very user-friendly model. It was developed by Graham and colleagues, and it's really based on planned action theories, 31 different theories that really guides adult learning, practice change, and various different educational theories and psychological theories. And so it's a model that's really widely applied in KT studies. And so what you want to do is it's a two-step process. The first process is really looking at knowledge creation, so making that research knowledge very relevant to the end user. And then the application process, or the action cycle, which is really looking at how do you actually implement. And there's like a stepwise, there's different steps that are involved in actually implementing this knowledge into practice. So I'm going to introduce you to that knowledge to action model. So it's a really great, very easy to understand and use model. And so we're going to focus on the middle part here, which is the knowledge creation step. And so I'm going to talk about that. And then later on, we're going to work towards the application or the action cycle, where we're going to walk through the different steps that are involved. So this is the knowledge to action model. So that first step is really looking at knowledge inquiry. It's being able to figure out what are the best ways to generate that research knowledge. And so you're really tapping into those primary research studies at this point. You're trying to figure out, what are the RCTs, the peer-reviewed articles that you can have available to you. So you're really tapping into the research evidence and really trying to distill and identify the highest quality evidence available out there to really shape your message. Then the next step is really synthesizing that knowledge. So you might also find systematic reviews or meta-analyses that exist in your topic area. But you're also tapping into the other areas or other sources of knowledge. You might want to, speak to clinicians, frontline clinicians, to generate that or understand that experiential knowledge that they have about that research area. And what they found was to be knowledge that they've gained over their years of clinical practice. And so you might want to also understand what that, where that comes from, and use that knowledge to sort of shape your research, your evidence. And so, you're tapping into that source of knowledge as well. And then finally, so not only from research evidence, but you're also trying to tap in from that experiential knowledge, that feedback from patients, to really review all that knowledge and package it in a way that is very easily understandable by your end users. So that's like that, creating that knowledge tool or product. It's that third generation information. And so really you're training, again, basing it on the best available evidence, but distilling it from various sources of knowledge, in order to create either a practice guideline, a decision aid. It could be a website or a self-management guide. It can come into different shapes and forms, but the idea is that this information has been tailored to the knowledge user, and it's been distilled, and it's been produced in a way that it creates meaningful messages to the knowledge end user. So once you've created a knowledge tool or product that's easy to understand, easy to apply, it's based on the highest quality research evidence and feedback from frontline clinicians and patients. So it's been sort of vetted out by the different groups. Then the next step is really you're ready to actually implement this knowledge tool or product, or this body of knowledge, into clinical practice. And so the next step here is really looking at the problem at hand. So what you want to know here is you want to really identify what are the actual knowledge and practice gaps that exist in clinical practice. And so this is sort of what's really important here is using rigorous methods to conduct a environmental scan or a needs assessment or a learning needs assessment. These are just different words, but really kind of looking at the same thing. It's using these methodologies to figure out or measure what are the gaps in knowledge among the among the knowledge users, and what are the gaps in their practices. So you want to understand, what's the actual knowledge that these individuals have, their skills, their attitudes, what are their practice behaviors, what are the actual behaviors they're doing in clinical practice. And then you want to compare that to what does the evidence suggest that should be the knowledge base, what are the evidence-based skills, what are the evidence-based practice behaviors, the ideal practice behaviors that should be adopted by these individuals. So it's really doing that comparison to understand the extent of the practice gap, because pretty much that extent of practice gap is what's going to dictate what your knowledge intervention or KT intervention is going to look like. So here in the process of identifying these knowledge or practice gaps, it's really important to involve various stakeholders in the process. So it could be the knowledge users, other healthcare providers, patients, decision makers, and so forth. Another way to measure gaps, so you can do that, sorry, whoops, I missed a slide, but you could measure gaps in different ways. So you can measure gaps at the population level by using administrative databases to really understand gaps in the care that patients are receiving. You could look at it more from the organizational level by tapping into the organizational database to really understand, or looking at patient records to understand, what is being done currently in terms of clinical practice, what's currently being offered in terms of assessment, in terms of intervention, to really understand what those gaps are like. And that will really dictate then how much work is needed in terms of changing practices with your KT intervention. So this is really a very critical step in knowledge translation, is really understanding where people are at in their current practices. But then you can also look at this from a healthcare provider's perspective and level, where you're really looking at doing a chart audit to look at very individual physicians, practitioners, to see, what is their current practices. You could use different other methods like observation, competency tests, or quizzes to really gauge their level of knowledge about a certain topic area, research evidence, or practice. You could just simply ask clinicians to reflect on and report on their practices, but of course it's not as objective as doing a chart audit. You could do focus groups and surveys, but there are different ways, both qualitative and quantitative, that you can use to really collect this information and get a sense of what the gaps are in terms of practices at the healthcare provider level. So once you've done that step, then the next step is really looking at adapting the knowledge to the local context. So here, this is where you're trying to adapt the knowledge or figure out what are ways that you want to really consider the local context, understand what's being done in the practice setting, understand what are the resources out there in a particular setting, just to make sure that you're not duplicating efforts. Are clinicians currently aware of this knowledge? Are they currently using those assessment tools that have been recommended? So it's really understanding what's going on out there in that current particular context. What are the resources that they have available to them? Because perhaps the research evidence that you're hoping to implement, or the new protocols that you're hoping to implement, maybe that practice setting does not have the required staff, equipment, or resources, or even skills. And so it's really understanding what the local context looks like. And so, as you can imagine, different local settings or different clinical settings have very different contexts. And so some might be more advanced than others. And so it's really important to do that homework and really understand, what's that local context like and how you need to maybe adapt that knowledge to that local context. And so these are just important things to consider. So the way that you might go about doing this is really, involving the key stakeholders in the process again, and you might do this using a more qualitative approach. So often you might think of involving stakeholders in a focus group where you're reviewing the research evidence. So if you're trying to implement a protocol, for instance, you might want to take the time to review that protocol with the stakeholders at the table and see, are there parts of the protocol that need to be adapted, or can it be taken just as it is and implemented? So, there's only so much modification that you can actually do with the, certain research protocols or certain practice or care protocols, because you do want to preserve the integrity of that research work or of that those guidelines. And so you can adapt it to your local context, but there's only so much that can be adapted. And so again, it's really done through a rigorous process. And it could be done again through focus groups. And so this is just a link to the Adapt resource, which is a toolkit that can be used to adapt guidelines. And so you could use, there are resources out there that can be used to systematically or rigorously adapt research guidelines. But essentially what you want to be doing is you want to be, as a group, reviewing the evidence. Is this research protocol or treatment protocol, is it really consistent and current, applicable into that clinical context? Is it feasible? Is it sustainable? Do we have the required resources, skills, and equipment? So these are things that need to be discussed as a group and then adapted accordingly. So once you've identified the gaps in the local context, you've really understood, how it needs to be adapted to the local context based on resources that are available. You then need to do that next step of identifying barriers to knowledge use. This is a real critical step in knowledge translation, and often this is where things can go wrong. So if this is not really done well, this is where often you try to implement a certain practice, and then it's often not uptaken at that point. So what we mean by clinician barriers is here it's really important to use scales or measures to really identify what are the clinician barriers. So looking at there are barriers in terms of knowledge. So what's their knowledge in regards to that treatment protocol or that research evidence? Are they aware of it? Are they familiar? And of course, we know that there are many barriers in regards to clinicians being able to stay up to date with the research evidence. What are their attitudes towards the evidence? So they may be aware that there's practice guidelines out there, there are treatment protocols out there, but that they may actually not agree with that research evidence, or they may not feel that it's applicable to their client population. And so it's really understanding, do they, what are their attitudes towards that evidence? Do they actually agree? Do they feel that it's actually going to offer the optimal outcomes that the evidence is suggesting, or do they not feel that it's something that's actually that they feel will actually apply or be beneficial to their clients? So it's really figuring out, do they have the right attitudes? Because of course, if they don't, you're going to hit a roadblock there. And so these are things that are important to measure. So another thing that's important to measure from the clinician's perspective is really looking at practice style traits. So if you think of practice style traits, clinicians, all healthcare professionals could be very different in the way they perceive new research information and how much value they place on that information in their clinical practice. And so, each one of us could be very different in terms of what we consider as credible sources of evidence, the value that we place towards research evidence versus our own clinical experience and what it has taught us, our professional training and what that provides. We're each very different in the weight that we assign to very practical concerns. So, the way that we want to manage our workload, patient satisfaction, and those more practical or pragmatic concerns that we may have. So that, the weight that we assign to that could be very different. And then finally, how willing are we to diverge from the group? And then, say, attend a conference, hear about a really interesting treatment approach, and then try to implement it on Monday morning. How willing are we to diverge from group norms and, the importance that we place on that? And so we could be very different. So I'd like to introduce you to a practice style traits questionnaire. It's a questionnaire that can be used to identify where we lie in that spectrum of, being willing to change our practice behaviors. So there are actually 4 different categories. And so you could think of, where do I fit in here in terms of my practice style traits? So each one of us can identify as being either a seeker, a receptive, a traditionalist, or a pragmatist. But we can also fit under other, which is where we kind of fall into one or more of these categories. So a seeker is somebody who's very easily willing to adopt new practices. They read the latest RCT, and they review a systematic review, and they're ready to change their practices right away. So that's someone who's considered as a seeker. Someone who's receptive, on the other hand, is someone who's evidence-based oriented, but they're really only willing to change their practices once they've got the go-ahead from their supervisor, department head, or the department chair. So they're really receptive to change, but wanting to get that backup or that feedback from or the support from the higher up or a respected colleague. Someone who's a traditionalist, on the other hand, is someone who relies on their own clinical experience, their own professional training, as well as the feedback or the backup of their respected authorities or their department head, senior colleagues. So they're very much more traditional in their practice patterns. And then finally, someone who's a pragmatist is really concerned with the more day-to-day concerns of their workload, patient flow, making sure that they address those waiting lists, patient satisfaction, and so they're much more concerned. And so it's not that they're not willing to change, but that the research evidence really needs to demonstrate that they can actually be as effective and as efficient as a clinician to really address those patient demands or the patient flow, and so that it wouldn't really stop them from that. And so that's an important point to keep in mind. just one thing I want to keep it. Yeah. So it's, keeping the practice style traits is very important in a knowledge translation study, because based on the individual's practice style traits, you can then tailor an intervention to speak to them. So if you've got a treatment protocol or a practice guideline that you're hoping to implement, and you're providing an educational session or a workshop on it, by keeping in mind these different practice style traits, you could then tailor your message differently. And so, for instance, if you've got a room full of seekers, you might decide to, share research articles, that really demonstrate the benefits of that treatment guideline. And so, providing them with that research evidence or walking them through those articles would be very important in your educational workshop. But if you're designing an educational workshop to implement a guideline, and you've got a room full of pragmatists, here you need to really show how it's going to make their practice much more efficient. If you've got a room full of traditionalists or receptives, you might want to make sure that you've invited the managers or department heads to make sure that they've got their buy-in in order to then hopefully promote the change of practices in the other individuals in the room. So those are just different ways or strategies that you can use to really use the information about practice style traits effectively. So other barriers to keep in mind. So we've talked about clinician or healthcare professional type of barriers. There are other barriers to keep in mind that's more organizational. And so, of course, if you're trying to implement any kind of practice change in a clinical setting, you need to really keep in mind that, what are the organizational barriers that exist? Do professionals or healthcare professionals, do they have enough time available for continuing education? So if you're thinking to offer a workshop, or you're trying to implement a guideline or a treatment protocol, do the clinicians have enough time for that type of continuing education? And will they have the time, the resources available to really implement that evidence in their practices? Do they have any, that peer support? Do they have funding, or do they have an organizational culture that really supports practice change? These are really important things to consider when you're trying to elicit this type of change in a setting, in an organization. So ways that you can assess practice behaviors, you can go about it in different ways. I'll introduce to you in later slides different quantitative measurement tools that you can use to really measure these barriers in a more quantitative way. But you could also go about it very qualitatively through focus groups, through interviews, questionnaires that you can use. There are also theories or theoretical frameworks that can be used to really understand, what are those determinants, or, what are the determinants that really influence people changing their practice behaviors. And so there's the theoretical domains framework and the consolidated framework for implementation research. These are two theoretical frameworks that can be very useful to really examine in detail, what are the determinants, or what are the factors that can really influence practice change, and that can really optimize your KT intervention or implementation plan. So once you've really identified these barriers, you could then design your effective KT intervention or your educational workshop, no matter, whichever way it may look. So now we're going to talk about, what are those KT interventions? What is it going to look like, and, how to design them? So there are different types of KT interventions, and this is another very important step that you really want to engage your knowledge users in figuring out what are the best ways that they want to learn information. So here, if you've got a practice guideline that you want to implement, you really need to, sit at the table with the, the knowledge users in front of you and figure out what are the best ways for them to learn this information. So you might think of printed materials, web-based materials, distributing this kind of information, educational meetings, workshops. You might want to actually have a outreach visit, which is having a content expert who's either off-site coming in to the clinical setting to really deliver that educational workshop or the in-service. So, involve, getting basically content experts from the outside coming into the clinical practice setting and providing that in-service or that outreach visit. Opinion leaders is another strategy, another KT effective strategy that really basically identifying a colleague or a healthcare professional who's on site at that clinical practice, who's known to everybody, to be the one who's respected and who can actually deliver that educational workshop. It could be perhaps a senior colleague who has some expertise or some knowledge about this practice guideline or that treatment protocol. And so they would be the ones to actually deliver the workshop or deliver the in-service. So that strategy is called opinion leaders. You could have a knowledge broker, which is basically an individual who's hired on site to be the implementer. And so that person actually is there to implement all kinds of research evidence. So some centers or some clinical sites actually have hired knowledge brokers because because in the literature, knowledge brokering is found to be a very effective strategy to implement research evidence into clinical practice. So this person, their designated role is to basically implement. And so what they do is they review the research evidence, they synthesize it, they do sort of the exchange with the knowledge users, and then they implement it in that clinical practice. And they are there to really problem solve or troubleshoot to see if there's any issues. So they're a person who's really on site and not known to they're sort of a known face as well. Another very effective strategy is chart audit and feedback. So this is where you review the charts to see are the practices being adopted, yes or no. You present the educational workshop about the practice guideline, about the treatment protocol that you have, and then you review the charts to see, are there any changes in practice? Is that new practice being implemented? If not, you give the feedback back to the knowledge users or the healthcare clinicians that are involved, that are recipients of your KT intervention, and you provide them with that feedback, and then you go back to the charts and then review again and do an audit. So this feedback loop has found to be very effective to actually yield very good practice changes. So the ones in red have found to be having moderate levels of effectiveness in terms of being effective as KT strategies. But what we found in general in the literature is that using a combination of different KT strategies or interventions is very effective, or is more effective than the use of just one KT intervention. And of course, passive dissemination just by emailing or mailing out research articles has found to be ineffective as a strategy as compared to more active interventions such as workshops, where you're really trying to get individuals to learn using a much more hands-on approach. So that's something really important to keep in mind. So using a variety of different interventions or strategies, and making sure that your strategies combine both passive dissemination, but also active interventions. So once you've done that, once you've designed your KT intervention, you've implemented it, then the important next step is really looking at outcomes. So you could use a theoretical approach to outcome measurement using a logic model or using the RE-AIM framework. But essentially what is important to keep in mind is that you really need to think about what outcomes you want to measure, not just patient outcomes, but looking at, did the individuals who attended my in-service or educational workshop, did they actually improve in their knowledge about that practice guideline? Did they change in their attitudes in terms of the guideline and its application into their practices? So their attitudes towards that evidence is really important to measure. And then finally, looking at their practice behaviors. Did they actually integrate that guideline or integrate that treatment protocol in their practices? So it's really looking at very objective measures like a chart audit to see did they actually change in their practice behaviors. So then once you've, the idea is that if you've changed and improved, their knowledge users' knowledge and their attitudes, you're more likely to create a strong foundation to ultimately change their practice behaviors, which will then in turn enhance patient outcomes. So this is where, once you see that adherence to guidelines or that adherence to a certain treatment protocol, that you can then see an impact on patient outcomes. But if you just focus on patient outcomes, you will really never know, did your intervention, KT intervention, was it really effective in changing knowledge and changing attitudes? So it's really important to understand that process and use those process outcome measures in your outcome measurement plan. So this is just an outcome evaluation framework that I wanted to share with you, and hopefully you'll have a copy of these slides, but that you can really take a look at the different types of outcome measures that can be used to measure change in knowledge, change in attitudes, and change in practice behavior. So I just wanted to share that information with you in a table that's been summarizing all the different outcomes that you can look at. And so I'll just leave that for you. And then finally, the last step of this knowledge to action model is really looking at sustainability. It's actually something that you do need to think about right at the beginning of your project, but sometimes it's kind of an afterthought, but regardless, it needs to be thought of. It's really thinking about, once you've actually implemented a change in knowledge, how could you make sure that this sticks? So all the efforts that you've done in order, and all the monies that have been spent to really implement a new guideline and make sure that it adheres, you want to really make sure that, what could be certain actions that might be taken by the managers to make sure that that knowledge is being sustained, that practice change has being sustained. So any, what could be some actions that could be taken by the leaders or managers, who would be the key person responsible for continuing that implementation and making modifications as new research evidence is coming forward. Who's going to be in that front line, who's going to be actively involved in sharing that those updates. Do you need any kind of funding to make sure that this knowledge is being sustained? We talked about educational workshops. Is there a way to actually videotape or tape those workshops or those in-services so that, people coming in, new staff or new hirees can actually benefit from those educational workshops as well? What are ways that we can sustain this knowledge use and sustain these practice changes so it doesn't just sort of fizzle out at the end? And then are there certain key stakeholders that we can use, or any power that we might leverage by creating policies or putting things in place to make sure that this practice change is sustained for the future? So it could be involving professional associations, the orders, college, different colleges and different professional associations that might be implicated, even the government, in this type of process of sustainability. So that's another really important step to keep in mind. So I'd like to actually turn I'm going to stop sharing my screen at this point and take the last few minutes to really discuss any projects that you have ongoing, any research work that you have that might be, any questions about, well, of course, questions about the content that I presented, but anything that you'd like to share at this point in time. So I'm just going to stop sharing my screen. Oh, I think I stopped sharing my screen. So please feel free to share in the chat, unmute, and kindly, ask your questions. I've sort of run through the slides, but, feel free, if I can go back to them, I'm happy to do that.
So I'll be responsible of the question period. So if you have any question, comment, or want to talk about your project as Anita proposed, so please feel free to raise your hand and unmute. So take the mic.
Or any maybe clinical gaps that you've identified in your practice. Oh, I see one. Sherry, thank you for, go ahead.
Hi, I'm a senior person, but I wanted to share something with you because I'm curious about your take, given all your experience and interest in knowledge translation. And that's applying your schematic to rare disease research. I think it works really well for pediatric migraines, for ADHD medication, for asthma. But when you're getting into a context of a pediatric rare disease where the stakeholders, particularly the patients, are so hungry for a cure, so you have that pressure, when you know that the patient numbers are too low to come up with the large, robust, randomized controlled trials that stratify for all the confounding variables, and when you have government balking at increasing pharma prices, how can you apply a knowledge translation model to that context?
Well, you have an excellent question. Thank you very much for bringing that in. So well articulated. Thank you. And you know, it's a concern that has been dealt with in this area. And what's great about the methodology knowledge translation is that it lends itself well. So the idea is that it's really open to various sources of knowledge. I think that's what's really key. So in the areas, and so my background's in rehabilitation. So you know, there's a project in relation to arthrogryposis, right, which is a very kind of rare condition in pediatric populations. And so in Montreal at the Shriners Hospital, there was a project that was being done in regards to rehabilitation for these clients, and what could be guidelines, or what could be, what could be things that could be offered to these clients, to these pediatric clients. And so what ended up happening was, they actually developed, somewhat of a guideline through collaborations with physicians, with rehabilitation specialists who had tons of years of expertise with this particular rare disease area and this group, and so it's basically sharing the knowledge that they've gained, the clinical expertise that they've gained, in order to generate some kind of common ground or guidelines that they could come up with, clinical statements, anything that can guide or make practices somewhat consistent, or inform practices of clinicians who are really reaching out for that kind of information. So I think what's really important here is that exchange process, that knowledge exchange process, that, in areas like that are really rare, it's hard, you can't grasp and find research evidence. And so then you need to really look back to the clinicians, go back to the patient partners, go back to the patients themselves who experience these conditions, to really learn and exchange and figure out what has been certain lessons learned and guidelines that they can draw from, and then share that information through these through a KT strategy, through a dissemination plan. So that's hopefully addressing your question, but I'm happy to.
Yeah, it is, and that's exactly what we do in the real world. And we even, we are often, however, really halted by CADIS and by do you know the Canadian Agency of Drugs and Health Technology, which is sort of a vetting agency that has to give pronouncements on drug development moving into actual acceptance into the payer schemes and into practice. And the problem is, they have a very economic analysis. It's all cost and benefit. And while I understand that, if we are out to try to help patients live better, help families live better, it's an extremely difficult situation. And I think that if you have any references that you could send out, particularly with getting that sustainability step, which also means economic sustainability in the context of a rare disease, I would very much love to see them, because I don't know that literature.
Yeah, no. So I'm happy to share with you literature on designing KT interventions for rare disease groups. So that on one front, and secondly, how do we go about, looking at sustainability, and what are some strategies that we can look? I don't know if it's not specific to rare disease groups, but in general, what could be some strategies to overcome the obstacles that you've been just highlighting in terms of addressing those things in knowledge translation?
Thanks a lot. I'd appreciate it.
Yeah. So I will, I guess, if you don't mind putting your email address
I shall. I'll put it in the chat.
Okay, thank you. If you don't mind, privately or whichever way you'd like to share it. But my email address is also available on the slide, so I'm happy to take your questions or to share resources via email as well. Any other questions?
I think also for trainee, when Anita came to present at McGill, like I think one of the steps is knowing about knowledge translation, but then how to apply to the project. And I think we may not have time today, but like I would suggest that if you have a question, how to start, with your specific project, would be to reach to Anita, because quite a few trainees did it at McGill, and then it was very useful. Sometimes it seems like hard, to start, but then when the practice come to an end, she's great at that too.
Yeah, so it was really great. Like I will share with you by email an article on KT, but also a blueprint to really design a KT intervention. And it really helps kind of consolidate your ideas of what's the evidence that you have and how can you design an educational intervention, and what are things to think about. But I would be happy to engage in a discussion with you or consult with you in regards to your project ideas, and share some ideas in terms of what could be best methods to answer those questions and to design an effective knowledge translation study. So very happy to do that. I very much enjoy these types of workshops, and so I'm happy to do that hands-on work with you. And so I see that there's some emails, and so I'm very happy to share those articles, but also feel free to reach out to me with your research ideas, and we can work through a possible blueprint.
Thank you very much. Yes, there's a couple of comments of people interested with the rare disease KT papers. So you have a couple of emails right now.
Special workshop.
Yes. So, kindly, maybe, I don't know if I can save the chat, but if you don't mind kindly sharing the link or like, I guess the chat, let's see if I can do this. Not sure if I can. Yeah. And if there's any other questions, I'm happy to, let me see if there's a way I can save the chat. Maybe not, but if you don't mind, kindly save it.
Yeah, Linda, could you send all those emails to Anita? Oh, sorry.
Absolutely, no problem.
Thank you, Linda.
Anita, you could type your email, maybe in the chat.
Of course, yeah, I could do that as well. But I just don't want to miss out the those who have shared their emails and specific, I think, questions or content they were hoping to. Whoops. Anyway, it's anita.menon@mcgill.ca. So any other questions or any other, I realize I'm a few minutes past it, but I'm happy to stay and answer any questions if there's anything.
I think you're perfect timing.
Okay.
Thank you again, Anita, for everything.
No problem. Thank you all very much for attending the talk, and I look forward to sharing that information with you all. So thanks a lot.
Have a good day.